Namaste, myself Shivi Saxena, Faculty of Physiotherapy and Diagnostics, Discipline Medical Laboratory Technology. My topic is malaria parasite. Introduction. A single-celled and animal-like organism, hematozoans, group of blood parasites. A single-celled parasitic organism, protozoan that facilitating sexual and asexual generation. Plasmodium, the genus that caused the disease malaria, causes death to many people, especially in Africa. Anopheles genus of female mosquitoes that carry or transmitted malaria. Plasmodium falciparum and Plasmodium vivax, the most common species of parasitic Plasmodium. Classification. Scientific classification is kingdom Protista, subkingdom Protozoa, phylum Apicoplexa, and class Sporozoa, order Eucoridiidae, and family Plasmodiidae, genus Plasmodium, species Plasmodium falciparum, Plasmodium vivax, Plasmodium ovule, Plasmodium malariae. General description. Plasmodium falciparum found in tropical and subtropical areas. This is the only species that can cause several malaria to the host. Plasmodium vivax, found mostly in Asia. It is the most common malaria, has a dormant stage called hypnozoids. Invade bloodstreams after weeks or months after the vector bites the host. Malaria. Malaria is one among the world's biggest killers. It infects up the 250 million and kills nearly 8 lakh people per annum. Consistent with the planet World Health Organization, total dies every 45 seconds as a result of the disease. Malaria may be a vector-borne disease caused by a single-celled protozoan parasite called Plasmodium, transmitted by female mosquito. At risk. Most of these dying from malaria are children, as they need not develop innate immunity to the disease. In Africa, malaria kills 1 in 5 children. And another high risk group is pregnant women due to natural changes within the system during pregnancy, which make infection more likely. Malaria in pregnancy can cause premature babies, low birth weight, and usually less healthy babies. Those traveling are areas of the world where malaria could also be prevalent also are is danger, as they are going to not have developed immunity there too. What cause malaria? 5 species of single-celled protozoan parasite Plasmodium can cause malaria is human Plasmodium falciparum, Plasmodium vivax, Plasmodium ovule, Plasmodium knowlesi, and Plasmodium malariae. Of these, Plasmodium falciparum is dominant species in Africa, is that the deadliest and is liable for approximately 90% malaria death per annum. However, it's been estimated that more people worldwide live in danger from Plasmodium vivax than Plasmodium falciparum, and as a result suffer increased morbidity from Plasmodium vivax. Each species of the Plasmodium parasite differs in phenotype, immune reaction, geographical distribution, and lipase pattern and drug response. Malaria may be a vector-borne disease transmitted from one person to a different by certain species of blood-sucking mosquitoes of the Anopheles genus, which incorporates how is malaria spread? Malaria spread by mosquitoes, the only mosquito which can transmit the parasite is the Anopheles mosquito. It feeds approximately every 7 days and carries the malaria parasite if it the previously bitten someone who had malaria. And mosquitoes act as a carriers for the parasite, and they are responsible for spreading the malaria parasites in this area. Therefore, mosquito bite avoidance is an important part of your prophylaxis. Mosquitoes life cycle. The female mosquito is in a position to get her eggs on almost and short of standing or slow flowing water, breeding in temporary puddling like hoof prints and tridents. Solo natural ponds, marsh, irrigation ditches and water tanks. The laying sites of depends upon the species of mosquito. The female lays between 100 to 300 eggs at a time. It takes 1 to 5 days for the egg to hatch. After the egg have hatched into larvae, they prey on microorganisms present within the water. The larvae then become non-feeding pupae. During this stage, the adult insect is made. The cycle takes 7 to 21 days, counting on the ambient temperature. Cycle in human. Firstly, hepatic cell inject a hepatic cells and hypnozoite a hepatic dormancy and convert to mature liver syngyne, that means merozoites released, and erythrocyte trypanozoites and erythrocytic sinusoids, and rapture erythrocytes the release xenotypes, and start in mosquito cycles. The convert microgametes and macrogametes and zygotes and mosquito midgut in ookinete and oocyst, then bursting cyst and sinusoids to salivary glands. Sign and symptoms. Malaria is usually classified as asymptomatic, uncomplicated or severe. Asymptomatic malaria can be caused by all Plasmodium species. The patient has circulating parasites but no symptoms. and uncomplicated malaria can be caused by or Plasmodium species. Symptoms generally occur 7 to 10 days after the initial mosquito bite. Symptoms are non-specific and can include fever, moderate to severe shaking, chills, profuse sweating, headache, nausea, vomiting, diarrhea and anemia with no clinical or laboratory finding or several organ dysfunction. And cerebral malaria. So, cerebral malaria is usually caused by infection with Plasmodium falciparum, though less frequently can also be caused by Plasmodium vivax or Plasmodium knowlesi. Complication include several anemia and end organ damage, include coma, several malaria, pulmonary complication, for example edema and hypertonic syndrome, and hypoglycemia or acute kidney injury. Cerebral malaria is often associated with hyperparasitemia and is associated with increased mortality. And learn more about the laboratory diagnosis. Laboratory diagnosis of malaria require the identification of the parasite or its antigen products within the patient blood. The requirement of a diagnostic assay are specificity, sensitivity, simple performance, and an inexpensive cost. Currently available techniques are often separated in three categories: microscopy, immunological technique, and molecular techniques. First, microscopy. Thick and thin blood smear study. Thick and thin blood smear study is that the gold standard method for malaria diagnostics. The procedure follows these steps: collection of peripheral blood, staining of smear with Gismustine, and examination of red blood cells for malaria parasites under the microscope. The first, thick smear. It is not fixed in methanol. This enables the red blood cells to be hemolyzed and leukocytes and any malaria parasite person are going to be the sole detectable elements. However, the hemolysis may cause this diastole plasmodial morphology, making Plasmodium species differentiate difficult. Therefore, thick smear are mainly want to detect infection and to estimate parasitemia. And thin smear, it's fixed in methanol. Thin smear allow the examiner to spot malaria species, quantify parasitemia, and recognize parasite form like gametocytes and synzoid. Second, immunological techniques. Firstly, antibody based techniques, जिसमें हमारा एंजाइम लिंकेज इम्यूनोसॉल्वेंट एसे दैट मीन्स ELISA. This method uses a soluble malarial antigen coated on a walls of a microtiter plates, and if the test is positive, the body find the antigen leading to a clear color change, and when the test negative within a absence of antibody, there is no change of color or the substrate. Second, indirect fluorescent antibody test, that means IFAT. Second, antigen based technique, rapid diagnostic test, RDT. RDT may be a device which will detect malaria antigen during a bite of blood. 5 mul by immunochlorometographic assay, color change in an absorbing nitrocellulose strip with monoclonal antibody directed against the parasite antigen. Counting on the target antigen rapid test that now exist may involve combinations of the following: HRP2 histidine rich protein. Second, may be a protein produced by the asexual stage and gametocytes of Plasmodium falciparum expressed on the membranes of red blood cells. If often persist in patients' blood for weeks after successful treatment. Plasmodium aldolase is an enzyme of the parasite glycolytic pathway expressed by all malaria species. Pan-malarial antigen, the short form PMA. Second, lactate dehydrogenase, that means LDH, may be a glycolytic enzyme produced by asexual and sexual stage or parasite and released by infected red blood cells. The HRP second test strip have second line, one for the control and therefore the other for the PFHRP second antigen. The PFHRP second and PMA test strip and therefore the PLDH test strip have three lines, one for control and there the other two for P falciparum and non falciparum antigen. Change of color on the control line is important for the test. To be validated with color change only on the control line and not within the other lines, that test is considered negative. And molecular techniques, PCR. Prevention. There is significant risk of getting malaria if you travel to an affected area. It is very important you take precautions to prevent the disease. Awareness of risk. Find out whether you are at risk of getting malaria. Bite prevention. Avoid mosquito bites by using insect repellent, covering your arms and legs and using a mosquito net. Check whether you need to take malaria prevention tablet. If you do, make sure you take the right anti-malaria tablet that the right dose and finish the course. Diagnosis. Seek immediate medical advice if you have malaria symptoms, including up to a year after your return from TB. Treatment. Malaria can normally be treated with anti-malaria drug. The short of medicine and length of treatment depend upon which type of malaria is diagnosed, where the patient was infected, the age of the patient, and they were ill the patient was at the beginning of the treatment. Travelers visiting endemic areas can take anti-malaria drug to stop infection. Depending upon the drug prescribed, they will got to be hunted to 2 weeks before traveling. During the amount the person is away and 4 week afterwards to be effective. These therapies combine Athenemis or one among its derivatives with another antimalarial and antimalarial of a special class. Thank you.